Good day, I'm Jen Antonio Flores and I'll be explaining the 4nf and 5nf. 4nf. Inside in the 4nf there's the admission, and here is the type of admission. There is edit inline, edit, explain SQL, create PHP code, and refresh. Inside the admission there's a admission ID, visit ID, admission date, discharge date, room number, and admission notes. The second is billing. Inside in the billing there's a billing ID, visit ID, item description, amount, payment status ID. Next is departments. Inside the departments there are department ID, department name. The next is diagnose. There is a diagnose ID, visit ID, and diagnosis. Next is hospital department. Inside the hospital department there is a hospital ID, department ID, and department name. Next is hospital info. Inside in the hospital info there is a hospital ID, hospital name, hospital address, and hospital department ID. Next is lab test. Inside in the lab test there's a lab test ID, visit ID, lab test type ID, and result. Next is lab test types. Inside in the lab test types there is a lab test type ID and test name. Next is medication. Inside in the medication there is a medication ID, visit ID, and medication. Next is patients. Inside in the patients there is a patient ID, full name, address, birth date, sex, and contact number, emergency contact number, emergency contact number. Next is payment status. Inside in the payment status there are payment status ID and status name. Next is physician. Inside in the physician there's a physician ID, physician name, and department ID. Next is visits. In the visits there is a visit ID, patient ID, physician ID, visit type ID, visit date, reason for visit, and nurse in charge. Next is visit types. In the visit types there is a visit type ID and visit type name. 5nf. Admission. And inside in the admission there is a admission ID, visit ID, room number, admission date, and discharge date. Next is admission notes. Inside in the admission notes there is a note ID, admission ID, and note text. Next is billing item. Inside in the billing item there's a billing item ID, item description, and amount. Next is department. Inside in the department there is a department ID, department name, and hospital ID. Next is diagnosis. Inside in the diagnosis there is a diagnosis ID and diagnosis name. Next is hospital. Inside in the hospital there is a hospital ID, hospital name, and hospital address. Next is lab result. Inside in the lab result there is a lab result ID, visit ID, lab test ID, and result details. The next is lab test. Inside in the lab test there is a lab test ID and lab test name. Next is medication. Inside in the medication there is a medication ID, medication name, and dosage. Next is visit diagnose. Inside in the visit diagnose there is a visit ID, diagnosis ID. Next is visit request. Inside in the visit request there is a visit ID and lab test ID. Next is patient. Inside in the patient there is a patient ID, full name, birth date, sex, address, and contact number. Next is payment. Inside in the payment, there is a payment ID, visit ID, payment date, payment status, and total paid. Next is nurse. Inside in the nurse, there is a nurse ID, nurse name, and department ID. Next is patient emergency contact. Inside in the patient emergency contact, there is a contact ID, patient ID, contact name, and contact number. The next is physician. Inside in the physician, there is a physician ID, physician name, and department ID. Next is visit. Inside in the visit, there's a visit ID, patient ID, visit date, visit type, and reason for visit. Next is visit medication. Inside in the visit medication, there's a visit ID, medication ID. Next is the visit billing. Inside in the visit billing, there's a visit ID and billing ID. Next is visit physician. Inside in the visit physician, there is a visit ID and physician ID.